I think we found the fountain of youth.
A new trend that doctors say is bringing back youthful skin with no needles and no pain. There are endless potions and creams that promise to turn back the clock on aging. We all know that. But there's a new study out of Stanford University which shows that there is solid science behind at least one high-tech anti-aging tool. Ground Force Vicki Liviakis looks into the laser which uses light to make cells younger.
You're looking at a skin laser treatment so bright, normally you'd have to wear dark goggles. It's the blinding light that's not only making skin look younger, but is actually causing the skin cells to become younger.
We took the old skin and reversed the gene expression to a large degree to that of youthful skin.
That's right. It's actually changing the DNA of skin. A new Stanford clinical study shows that rather than just a cosmetic mimic of young skin, what's going on here is altering human genes associated with the aging process. And plastic surgeons like Dr. Elizabeth Lee of Berkeley and Lafayette are impressed.
It's kind of as close to the fountain of youth as we actually have.
The laser is called Cyton Broadband Light.
People started asking me what I was doing with them, what I was using on my skin.
Michelle is receiving the broadband light treatment here at Spa Radiance Medical in San Francisco to try and improve her skin.
Well, definitely. I mean, all the skin on my body has changed as I've gotten older.
And after 4 sessions, you might be surprised to know Michelle's real age.
I'm 43, almost 44.
People in their 40s and 50s are still producing a lot of collagen. They're going to get a better result, say, than someone who's, 70.
Your cell goes back to how it was 10, 15 years before. So literally, the cell becomes younger.
This is science. This is science.
I think we found the fountain of youth.
In San Francisco, Vicki Liviakis, KRON 4 News.
Well, the broadband light therapy is currently being used by a number of dermatologists and plastic surgeons in the Bay Area, mostly to treat skin damage from too much sun. But now that the Stanford study is out and showing that there are other anti-aging properties, you can imagine that that therapy will likely be in high demand.
I just had the Cyton Halo laser treatment and it was very easy. I was very well cared for and I cannot wait to see the results in a few days. This is exciting.
My name is Kristen Farrell and I host a TV show based here in Lake Tahoe. It's a live TV show and we cover all things Lake Tahoe. So in covering those things, we need to be familiar with them. And it gives me the opportunity to go be outside and enjoy the snow in the winter and the kayaking and the paddleboarding and the hiking and the biking in the summertime. So it encompasses everything that I love to do outdoors. I am outside all the time. I also have 2 young kids who I have with me all the time who love to be outside too, so I'm chasing them. I was always the one who had to be the most tan. To me, it showed that I had been outside. It was the healthy glow. That's what I perceived it to be. As I got older, into my mid-30s, I started to realize that kind of treatment to my skin started to catch up with me. I started to notice sunspots, a lot more wrinkles, and it definitely showed up more when I was on camera. And so I was having to put on more and more makeup in my daily life and to go do my job, to be on camera. So that's what brought me here, to fix some of that sun damage and to restore a more youthful appearance to my face. I think we're all our own worst critics. We've all looked in the mirror very closely at ourselves, and I surely had many of those mornings where I got up and looked in the mirror, and it was just one day where I said, I cannot look at splotched skin starting to age prematurely because of the sun damage and the damage I had done to it for one more day. And that's what made me pick up the phone and call Dr. Gelber, and we reviewed the options and decided that the Sciton laser resurfacing treatment would be the best, and it absolutely has been fantastic.
Halo has been the best of both worlds. It's the very first hybrid fractional laser, and it allows me to deliver to my patients the results of an ablative procedure with the downtime of a non-ablative procedure. And that is the best of both worlds. So you can decide how much ablation, and you can decide how much coagulation you're going to use. Regardless, you will see a significant improvement in your patient's sun damage. You'll see an improvement in tone and texture. And particularly when you use more ablation, you can actually improve wrinkles. These are all things our patients want, and when you can deliver them with a simple, easy treatment, they'll love it.
It was about day 6 where I was able to look at my skin and go, wow, that is night and day. Literally daily, I get to hear people say, your skin is just beautiful. Right after I did go back to work and I hosted my first show post-treatment, I got compliments. People wrote into the show saying your skin looks amazing. Other hosts of different shows that are taped throughout the day at the TV station came in and said, wow, what did you do? Your skin looks incredible. And I was proud to say, I don't have much makeup on at all. This is exciting. I'm turning 40 this year, and I look forward to maintaining a very active lifestyle that includes being outdoors a lot. And that's why I'm back 1 year later after my first Sciton laser resurfacing treatment. I'm looking forward to seeing what the latest is in technology now and maintaining healthy skin throughout the rest of my life. It feels really, really good to know that I did the right thing for my face and for my job and for my future. Feels good to look in the mirror and see that.
The feedback that I've gotten largely from patients over the years that have used broadband light has been that they prefer the treatments because they see, number one, a better result. Number two, the treatments are easier for them to have done. And number three, treatments are faster and quicker. That has given us a better result, faster results, and a greater degree of overall rejuvenation of the skin.
All right, well, whether you're dealing with sore and aching legs or if you're worried about varicose veins, our next guest can actually help you. Joining us now is Dr. Surya Chawla from Chesapeake Vein Center and Med Spa to tell us a little bit more. Welcome back to the show, Doctor.
Thank you for having me.
So, mostly women, but men too, they deal with these venous problems. Tell us a little bit more about it, and varicose veins. Are they the same?
Varicose veins are a type of presentation of venous problems. Lots of people have leg swelling, aching, heaviness. In fact, majority of people I see have heaviness and aching, and sometimes men and women too occasionally present with big varicose veins. That's one segment of this issue.
When should people start realizing that they have a problem and they need to seek some kind of help about this?
You know, in your day-to-day life, if you feel that your legs hurt a lot by the end of the day, or your legs swell, you feel like you have to put your legs up by the end of the day, or you have big veins or some skin changes at the ankle, those are the types of things that should tell you that maybe this needs to be looked at by a vein specialist.
What kind of treatments are available out there? What can you help people with if they deal with those issues?
At the basic level, I'd advise anyone who's engaged in a lot of activity involving standing, etc., to wear some sort of a compression on their legs. I run, and when I run, I wear compression sleeves that really help, for example. But we have lasers, we have very non-invasive treatments, helped a couple of thousand people at least with these type of non-surgical treatments, should they need it. Not everyone does.
How would you go about diagnosing the issue?
Are you aware of an ultrasound, the non-invasive test women get when they're pregnant? So we have a version of that that checks the leg veins, so we can easily do it in about 45 minutes.
So you're getting a very accurate diagnosis. You're not just thinking, oh, I have a problem and...
Well, as I was saying, as soon as I lay my eyes on someone, with the experience we have, I can tell. But the confirmation is always with an ultrasound that either proves or disproves it.
And again, what type of improvements do your patients report seeing after they've had the treatment that you're recommending?
You know, and I'll go back to my website, Chesapeake Vein and Med Spa. There's a testimonial page full of people who kind of detail their improvements. Majority of the time, what I hear is this non-specific type of feedback saying, "Doc, my legs feel so much better." Or people say, "My legs don't hurt anymore, they don't swell anymore, thank you, I can walk 2 blocks," things of that nature. Tell me, you know, you do a really good quality of life improvement day to day.
And it's not just something that affects older folks. I remember in my 20s, I started getting this random swelling in my ankles. So should people always be looking at their health and, you know, looking for changes in their body?
Truly, that is correct. Every decade this progresses because the causes are genetic. The manifestations come on with your type of lifestyle you lead, but it's genetic. So women in their 50s, for example, may have a lot more of these than women in their 20s, but certainly it's a good time to look down and see what's going on.
What's going on with your body. Thank you so much for coming onto the show this morning.
My pleasure.
And we want our viewers to know where they can learn a little bit more about Dr. Surya Chawla's treatments at Chesapeake Vein Center and Med Spa. They're located at 300 Medical Parkway in Chesapeake. Give them a call, 517-3297. You can also go online at Chesapeake Vein and Spa, veinandmedspa.com. Thank you for coming onto the show.
Benign vascular lesions are a common problem for many people. Fortunately, these lesions can now be treated with laser therapy, meaning fast, effective, and safe treatment with maximum patient comfort.
I had veins around my nose and some on my legs, so I had redness around in here.
I had 2 people that I trust and that are friends that had mentioned that I had those veins going down, and one of them was telling me that I should get it taken care of, that he had it done, and it was a simple process, inexpensive, and the result was fantastic, and he felt much better about himself. The second friend of mine I hadn't seen in a long time, and he actually thought I had been scratched by a cat, and I thought at that point it's time to take the first person's advice and get this taken care of.
ClearScan from Sciton is the solution for vascular treatments for all skin types, including dark and tanned skin. ClearScan is effective. It delivers the ideal wavelength for virtually all vascular lesions, allowing your physician to precisely treat visible vessels, broken capillaries, spider veins, and lesions. For larger vessels, ClearScan's wavelength penetrates and uniformly treats the entire vessel. It also penetrates deeper into the skin as compared to other laser options. For smaller veins, ClearScan allows your healthcare provider to deliver the precise amount of heat at the desired length of time to effectively cause the vein to disappear, allowing new vessels to replace its function.
It was great. It was almost like going in for a teeth whitening. When I left, I didn't have any veins in my chin. And the whole way driving home, I kept looking in the mirror. Couldn't believe what happened and why I waited.
I treated the veins that I could see wearing shorts. They were just bothering me, and they were just spider veins. So I had just one treatment, and they went away.
ClearScan is fast. Its robotic technology delivers precise and consistent results.
It took about 30 minutes, and they were removed completely. As soon as I left here, I went back, showed my wife, and returned to work.
ClearScan is designed for patient comfort and safety. With its powerful integrated cooling system, ClearScan gives your physician precise control over cooling, including full skin contact for maximum comfort before, during, and after treatment.
Just felt like a rubber band snapping. That's only the best description I can say is maybe someone snapping a rubber band on me.
She said I might feel a little bit of pain in the beginning, but I really didn't feel any pain, just the short shock. And after that, you got used to what it was going to be, so it was just a quick little zap. So there was absolutely no pain.
Vascular lesions may require multiple treatments. Your healthcare provider will determine the appropriate number of treatments needed to achieve optimal results. The ClearScan system can be used on all skin areas. Popular areas are the face, the neck, the chest, and the legs.
I'd do it again. I'm very happy with the results, and it took care of it on one try. I was really happy with that.
It was a relief when they were gone, and they were gone like that. And it was a great experience. One of those things I wish I would have done 5 years ago.
ClearScan, the solution for virtually all vascular lesions, including small surface vessels and deeper, larger veins. Technology that ensures fast and consistent results, and an integrated full contact cooling system for patient comfort and safety. That's ClearScan from Cyton.